Hi, my name is Denise Akins, and I will be presenting my capstone presentation, which is about the prevention of heart failure readmission. So chronic diseases, especially cardiovascular diseases such as heart failure, have received a great amount of attention from healthcare providers over the recent decades because of its increased morbidity and mortality rates. So here we're going to discuss the two types of heart failure. There are left-sided heart failure and there's right-sided heart failure. Most heart failure begins with failure of the left ventricle, and then it can eventually progress to failure of both ventricles. So you may start with one side and end up with both. So left-sided heart failure is commonly called congestive heart failure, and it's classified as either systolic or diastolic. So systolic heart failure is basically when the heart is not pumping enough oxygen to perfuse the tissues. So here we worry about our ejection fraction, which is the percentage of blood that is released during systole. A normal ejection fraction is between 50 to 70%. So with systolic heart failure, this number can drop to below 30 or 40 and can get as low as 10 to 15. Then we have diastolic heart failure. This occurs when the left ventricle cannot relax during diastole. Right-sided heart failure is when the right ventricle cannot empty completely. So this will lead to increased volume and pressure in the venous system. Heart failure is an escalating clinical and public health problem. It causes about 875,000 hospitalizations each year. And the risk factors include increasing age. The older you are, the higher your chances of developing heart failure. If you develop or have high blood pressure or any type of heart condition, such as cardiomyopathy, myocarditis, congenital heart disease, ischemic heart disease, valvular heart disease. Also obesity, diabetes, and renal failure, and excessive alcohol use. So the signs and symptoms of heart failure, they depend on the type of failure, the ventricle involved, and the underlying cause. So left-sided heart failure presents a little bit different than right-sided heart failure. Left-sided, you'll get some weakness, fatigue, dizziness, confusion, tachycardia, weak pulses, crackles or wheezes in the lungs, a hacking cough, dyspnea, scant urine. And right-sided heart failure is more of that pulmonary congestion. So you'll get some dependent edema. You'll get jugular vein distension, swollen hands and fingers, distended abdomen, weight gain, increased blood pressure. So here is an image that kind of shows how each right or left-sided heart failure presents. And you can kind of see the pulmonary congestion that's seen with left-sided heart failure. A key issue for patients and providers is how to deliver personalized behavioral support in a way that is affordable and can reach the most patients. So this part of the presentation, we're pretty much going to evaluate the effectiveness of a web-based education module designed to manage the symptoms of heart failure at home. So first we're going to start with Section 1. Section 1 is about patient education. So this module will teach patients about a heart-healthy diet. As part of managing your heart failure, the doctor may ask you to change your lifestyle, your eating habits, and adopt a heart-healthy, low-salt diet. So basically, you're going to limit salt. This means avoiding prepackaged foods, avoid foods that are fried, canned goods. They have a lot of salt. You're going to eat more fruits, vegetables, whole grains, seafoods, nuts, and seeds, olives, oil, and dairy. Patients need to be weighed daily and to monitor their fluid intake. So basically, this is to prevent any fluid retention. And this is how we're going to know whether the patient is retaining fluid or not. Then you're going to increase your physical activity. So you don't have to start a formal exercise program. We just want you to get up, get moving, and stay moving. So you need to do things that you enjoy. This includes gardening, cleaning the house, anything that gets you up and out of bed. So you want to mix match your activities. You don't want to do the same thing every day, because sometimes you get bored and you get so much into a routine that you don't want to continue to do it. You don't see it as an exercise. So pretty much just keep a record, don't get discouraged, and be active. So this program is going to get our patients up and moving. Then we have medication compliance. So pharmacological treatment is needed to manage heart failure. It can consist of diuretics, which are water pills. These pills are taken to help get the fluid out, so it'll cause the patient to pee a lot. Vasodilators, which reduce preload, ACE inhibitors, ARBs, digoxin, beta blockers, anything that's going to enhance contractility and decrease your preload and afterload. So these medications you need to take as prescribed to optimize the benefit of these drugs. And it's also important that the patient understands what the drug is and what it is supposed to do. So you need to make a list of all your medicines. And this program will teach these patients the side effects and everything that they need to know. The second part of this web-based program is going to send the patient computer reminders. These reminders will tell patients to take their medications. It's best to take them at the same time every day. That way you don't forget. It will remind the patient to weigh themselves. If they have an unexpected weight gain of more than 2 kilograms in 3 days, advice should be sought. And then it's going to tell the patient to measure their blood pressure and their heart rate. So every day this computer reminder will set off and the patient will get these things done. And then the last part of this web-based module is email capability. So patients will have the capability to contact expert clinical nurse specialists and physicians. They will have external links to video contents that are available on the web. And they can also electronically submit their daily weights, their diet ready use, their nutritional log. They can send these things to the doctor so the doctor can kind of keep track of what the patient is doing at home. The last thing we're going to discuss is guideline recommendations. So these guideline recommendations are from the National Guideline Clearinghouse. And basically they say that they recommend that when someone is admitted to the hospital, the first thing you want to do is assess at initial encounter and at every shift. So you're going to get baseline health history. You're going to go over the patient's symptoms, their medications that they're taking at home, and you're going to go over some lab values. One of the most important lab values for heart failure is the BNP. So this is a biomarker that is released when a patient is showing fluid overload, which is usually a sign of heart failure. So patients with a high BNP have really bad heart failure. Next, you're going to obtain a heart failure cardiology consult. This is basically you're getting the right specialist on board. You're getting the cardiologist on board that can customize this patient's treatment plan. Then you want to eliminate and minimize any risk factors. So you want to avoid any IV fluids, because why add on fluid to someone that's already in fluid overload? And then once you're able to get that fluid off, you want to keep it off. So you want to restrict the patient's fluid. Make sure they're not drinking too much. And as we know, salt is going to retain fluid. So we want to limit the salt. And of course, we're going to administer the medications. If they are non-compliant and they haven't been taking their medications, we need to educate them and we need to get them back on the right medications. And the last part of the recommendations from National Guideline Clearinghouse is provide self-care education. You need to assess for safety and ambulation because, first of all, these patients will be on diuretics. So they're going to be getting up all times of the night. They're going to be in an unfamiliar environment. You want to make sure that they're aware of their surroundings and you help them get to the bathroom. You want to maximize their mobility, limit the use of catheters. Of course, they're peeing a lot. So as healthcare providers, sometimes we think, okay, I don't have time to get that patient up to the bathroom. But with heart failure, we want to get these patients up and moving. We want them walking to the bathroom because previously they probably have not been moving as much as they should. So any type of activity is great. We want to communicate clearly. We want to provide explanations. Go over the medications if they have any questions, or get them to the right person. If you don't know, get them to the right educator that can answer their questions. And of course, we need to emphasize the purpose and importance of daily weights. Daily weight is how we know whether our patient is getting this fluid off. And this fluid is what's causing their heart to fail. So monitor their fluid. It's very important, and weigh the patient is very important. And we have to teach them how important it is at home to track their weight. Because if they notice that they're gaining weight, then they need to call the provider, or they need to come back into the hospital. So I work at St. Vincent's on the telemetry unit. We get a lot of heart failure patients along with cardiovascular interventions. So to compare what we do at St. Vincent's to these guidelines that were recommended, we pretty much do the same exact thing. When our patients come in, the first thing I'm going to do is I'm going to get their patient history. I want to know their activity tolerance. I want to know whether they're having problems breathing, whether they're having problems sleeping, whether their urinary pattern, their fluid volume status. This is all a part of my initial assessment. And we do the same thing. We get a cardiology consult. We have heart failure specialists that come in and they re-educate our patients, because a lot of times with heart failure, these patients have been educated time and time again, but somehow they're back into the hospital for heart failure exacerbation. So we're going to re-educate. We're going to get the right providers in. We're going to limit fluids, no IV fluids, and we're going to get them on the right medications. Thank you. And here's my references.